It's the Brian Lehrer Show on WNYC. Good morning, everyone. On today's show, we'll welcome New York City's acting sanitation commissioner, Javier Lohan. So many New Yorkers have complained about garbage piling up on the streets, right, since the big snow and ice storm, and in some cases complained about how the snow was cleared as well, and maybe even about how some of your neighbors are not doing their part to keep things as cleaned out as possible. We'll hear the commissioner's explanation and discuss what comes next as the big melt inevitably begins. Also, the new mayor of Jersey City, James Solomon, today, after the outgoing mayor, Steve Fulop, yesterday. And All of It producer Jordan Loff introduces the new Get Lit with All of It newsletter. It's a newsletter for book lovers. That'll be a fun segment. This will include a reveal of the upcoming Get Lit with All of It group reads that you'll be able to join in on. But we start here. One of the biggest issues for the midterm elections will be the affordability of health care. You'll remember that the government shutdown late last year was largely over the Democrats wanting to continue those extended subsidies for Affordable Care Act, or Obamacare, insurance policies, while the Republicans wanted the subsidies to end. The Republicans won that issue, remember, meaning the disputed subsidies expired. Now, government data released in late January indicates the number of Americans insured through Obamacare has dropped by more than 1 million people. So with health care costs looming as a midterms issue that seems to favor Democrats, President Trump last week announced a new program aimed at helping some people pay less for prescription drugs. The program is called, what else? TrumpRx. It's for people who do not have insurance.
This is a very big deal. People are going to save a lot of money and be healthy.
Well, how true is that claim? Let's take a look at TrumpRx with a leading healthcare reporter who will explain and answer your questions about who can save money through the program and who can't. We welcome Chelsea Cirruzzo, Washington reporter at the health news website Stat. She previously wrote Politico's daily health policy newsletter. Maybe we'll touch on some other health policy news as well, like Trump appointee Dr. Mehmet Oz now saying everyone should get the measles vaccine as outbreaks increase around the country, but the head of their vaccine advisory committee questioning even the polio vaccine now. Chelsea, thanks for coming on. Welcome back to WNYC.
Thank you so much for having me.
Can we start with how big a problem prescription drugs affordability is? I saw Dr. Oz on CNN the other day say a third of Americans, or 3 out of 10 Americans, almost a third, decline to buy medications they've been prescribed when they get to the counter and see the cost. And that comes from a Kaiser Family Foundation survey, so that's a mainstream number. Do you have demographics on that, like who's foregoing their prescriptions because of cost? Only people who are uninsured? Do they concentrate geographically or by race or gender or anything else?
That's a great question. I don't have numbers in front of me, but I can say it is certainly true that everybody is subject to the high cost of drugs, even if you have insurance. So certainly, I mean, it's a problem that, like you said, any voter could empathize with and understand that high drug prices certainly impact their lives.
Right. And Dr. Oz said in that CNN interview that Americans pay 3 times as much for the same prescription drugs as people in Europe do. I see that number comes from a RAND Corporation study. So again, it's a mainstream number. TrumpRx sets prices for 43 specific medications. The president singled out some for emphasis in his rollout announcement.
For example, you will see dramatic reductions in the cost of popular weight loss drugs known as GLP-1s.
And they're setting the prices based on what patients in other countries currently pay compared to Americans here.
Under the most favored nation agreements my administration has negotiated, the United States will pay the lowest price paid by any other country. So we're taking the lowest price paid for drugs we will pay equal to whatever the lowest price anywhere in the world. That's the price that you're going to be paying.
So, Chelsea, help us understand what that means. Build on those two clips. I see you've compared what GLP drugs like Wegovy and others cost now for cash-paying customers not using insurance, and what the TrumpRx price will be. Can you share some of that comparison?
Yeah, of course. So my colleagues and I compared the prices on TrumpRx to other websites like GoodRx and Mark Cuban's Cost Plus, which offer similar sort of coupons or discounts on drugs. It's worth noting that none of these websites directly sell drugs. They just direct you towards a coupon or a way of getting the drug cheaper if you pay through cash, which means not paying through insurance. Now, of course, it does include these GLP-1s like Zepbound and Wegovy, and like that clip just noted, that's notable because President Trump has promised to lower the costs on these drugs. And those makers, Novo Nordisk and Eli Lilly, are actually already selling those drugs at a discount. Now, when we did look at this analysis, it didn't necessarily lower prices as much as the president was saying. Like I said, you can find cheaper prices on GoodRx or Mark Cuban's website because you could be looking at generics. And generics are a drug. It's separate from the brand name drug. It's sort of the same drug, but it can be cheaper. So an example here, Chantix by Pfizer, which treats smoking cessation. You can get it on TrumpRx for a little under $95, but the generic on GoodRx was around $37, and on Cost Plus it was around $15. And we found about 22 drugs on the TrumpRx website do have a generic available that you can get for cheaper.
Yeah, the most extreme example I see on your site is for the heart arrhythmia drug Tocsin, $672 on TrumpRx, $9 for the generic version on the website Cost Plus. So why does TrumpRx only help pay for name brand drugs if the generics are so commonly used and cost less?
So this was all part of a deal that the White House struck with 16 pharmaceutical companies. And, we know that President Trump loves to make a deal. So he made these agreements with these pharmaceutical companies to list their brand drug prices on the website. But GoodRx, Cost Plus, they have different models and they can offer the generics. That isn't to say, of course, they aren't involved. I will note that GoodRx told us that they are partnered with the Trump administration to help bring their price integration over onto TrumpRx. But still, they do offer lower prices on their own website.
There's a critique on the Atlantic magazine website by one of the writers today that says the big winners for TrumpRx are actually the pharmaceutical companies, largely because they get a lot of good press for engaging, in this deal with Trump to lower some of the prices. I don't know if you as a reporter can critique that critique, but does that ring true to you, if you can say?
Here's what I can say. And earlier there was a clip where President Trump talked about most favored nation, which is his plan to make drug costs lower in the U.S. Than they are abroad, because they are lower abroad already. And to do that, he's brought in a lot of pharmaceutical companies into the White House. They've struck deals. In exchange, those companies have gotten tariff reductions, or they've been immune from certain things. And they've gotten a lot of attention. They are they're standing in the Oval Office with the president talking about their product. I can certainly say that likely helps them. That probably feels pretty good. So it's not a bad deal for the pharmaceutical companies.
Listeners, do you have a question about TrumpRx, or a question or comment on anything related to the economics or politics of healthcare affordability more generally, for you personally or as a midterm elections issue? Remember, part of our frame here, in addition to just giving you the information about TrumpRx, if it happens to help you with your prescriptions, there is the political context of Trump and the Republicans generally trying to play some catch up on healthcare as a policy issue for the midterms. 212-433-WNYC. 212-433-9692. You can call or you can text. We're going to get to how this affects pharmacists in a minute and pharmacies. There may be a reality that the Trump administration is actually laying some of this subsidy on your local drugstore. So we're going to play a clip about that and get to that. So pharmacists, welcome to call in, 212-433-WNYC. In addition to anyone else, questions, comments, stories, 212-433-9692 on TrumpRx and related issues with our guest from Stat. Is this only for people who are uninsured only?
Yes. Well, these are all cash prices. So that means you're looking at the price that you will get if you're not using insurance. Of course, if you have insurance, you could use this site and just buy a drug using cash and not using your insurance. But it doesn't really show you how much the drug would cost you if you use your insurance. And also if you're on federal healthcare programs. Some of these drugs don't include people on Medicare, which is for people over the age of 65, and people on Medicaid, which is people below a certain income threshold. So it's really limited in who can accurately use this tool to figure out what a drug will cost them.
So people can't use TrumpRx to cover their copays or deductibles if they have insurance?
No. And again, all of this is consumer driven. And we're going to talk about this more, of course, with the pharmacies. But it's really about what you as the consumer are willing to pay. Your insurance is completely separate. So if you want this drug and it costs a lot of money with your insurance, sure, you could go outside of your insurance and try to buy it just using cash. And that is when you might use a site like TrumpRx or GoodRx.
If you're insured. But you said if you're insured by Medicare or Medicaid, you can't, right?
Yes, you cannot.
Yeah. And maybe that would never come up in real life anyway. If you have Medicare or Medicaid, would TrumpRx ever be cheaper?
I mean, with Medicare, something else we're watching here are Medicare drug price negotiations. And that's a separate, actually a Biden era law that was passed that makes drug companies negotiate down the prices of drugs for people on Medicare specifically. Now, I will say Republicans, including the Trump administration, have been quite critical of that plan. They've tried to overturn it. But I will just say that the difference here compared to TrumpRx is Medicare negotiation is a law that no matter the administration, they do have to follow it. And therefore, we will certainly see those Medicare drugs negotiated down. Whereas these deals President Trump are cutting are voluntary, and it's really not clear what happens to the price of these drugs once he leaves office or if this no longer becomes a priority for him.
I'll follow up. I'm interested in this topic, the ability of Medicare for the first time under Biden's Inflation Reduction Act to be able to negotiate price. And that's, of course, for so many millions of Americans. So that's a big group with a lot of negotiating power to negotiate price with the pharmaceutical companies. And I read this morning that a Stanford University medicine website, or I read on that site, where it says for the first 10 drugs selected for negotiation, Medicare is projected to save $6 billion in 2026 alone, a 22% reduction in spending across these 10 medications. Does that get passed on to the consumer?
It depends. It's hard to say, right? Because this is so new. So we'll have to wait and see, where pharmaceutical companies, move around their profits. Of course, we've seen this happen all the time when health policy moves to cut prices. Companies or providers have to shift the way they're making money, right? They might hike up prices in other areas to make up the difference. So it's still worth seeing. But the one thing I will note, and you alluded to it here, is that the Medicare price negotiation law focuses specifically on the drugs that cost Medicare the most money. These are very, very expensive drugs. So it really does make a difference to negotiate them down. Whereas the drugs we're looking at in TrumpRx tend to be more focused on GLP-1s, fertility. That's not to say these aren't expensive drugs. They are. But the drug price negotiations are really focused on driving down those very high cost drugs.
And as you said, Republicans have generally opposed Medicare being allowed to negotiate prices. And I see that just last month, Democrats released a critique of what they deride as the Republicans' big ugly bill. Trump calls it the big beautiful bill from last year. The Democrats' critique says, quote, "The bill created a loophole that allows manufacturers of some of the most expensive drugs in the world to avoid negotiating fair prices for seniors. Without this loophole, Keytruda and Opdivo, two costly cancer drugs, would have likely been on the list for negotiation this year," unquote, from the Democrats' critique. Why are Republicans trying to weaken that Medicare negotiating power?
Mm-hmm. Yeah, so I had to ask my colleagues, Daniel and John, about this since they cover this a lot more closely. And I mean, they told me that the GOP has always been critical of the IRA drug negotiations. And I think, at this point, that they've really largely stopped trying to overturn the provision that was very popular early on when the IRA passed. Instead, Trump is trying to convince Republicans to pass his plan on the Hill, which could end up actually creating stronger government control than the IRA did. But Republicans are still pretty skeptical of that plan. So it's sort of a stalemate here in what the president wants versus how the Hill feels, given their feelings about Medicare drug price negotiation.
Listener writes, Medicaid will not cover GLP-1s. So how can someone on Medicaid get the TrumpRx? And the listener writes, this is important. I guess maybe it's important to them if they're on Medicaid. And is that correct, to your knowledge, that Medicaid does not cover GLP-1s, but you said people on Medicaid cannot take advantage of TrumpRx?
Mm-hmm. Yeah, so it depends on what the GLP-1 is being used for. State Medicaid plans do need to cover the FDA-approved GLP-1 drugs for type 2 diabetes. But they don't have to cover the weight loss drugs. So that is certainly true also depending on what state you live in. And yes, if you did want to use TrumpRx to purchase one of these drugs or to find a cheaper price, you wouldn't be looking through your Medicaid pricing. And of course, since Medicaid doesn't cover it for weight loss, you don't even have that option anyway. You would have to pay through cash. So you'd have to pay directly from your own savings and not from your insurance.
And another listener writes, yes, you can be on a Medicare drug plan and get a lower price with GoodRx. With each prescription you fill, you can compare the price under your Medicare plan to the price using a coupon. So I don't know if that includes TrumpRx, which has a relationship with GoodRx, but does that ring true to you?
Yeah, absolutely. And honestly, that's a better explanation than I had. That's true. Yes. So if you are on insurance, say you're on Medicare, you want to get a certain drug, you see how much the drug costs on Medicare, you can still go on GoodRx and TrumpRx and see how much the drug would cost if you did not use Medicare. Again, paying your own money, your own cash. And that, in some cases, could be lower than using Medicare.
So one more like that. Listener writes, I don't buy into Medicare Part D. That's the prescription drug part of Medicare. So if I don't buy into Medicare Part D, can I use TrumpRx?
Yeah, certainly. Again, it's not as though if you have insurance, you can't go on the website, forget it. You can, but you just need to understand that your insurance, whatever insurance you have, does not apply to the prices you're seeing. Those prices are as if you are uninsured, or if you are uninsured, I mean, that's the reality. So just to know that you cannot apply your insurance to the prices you're seeing.
Here's Debbie in Lower Manhattan, who I think has an anecdote about the cost of something here compared to in Europe. Debbie, you're on WNYC. Thank you for calling in.
Oh, hi. Thanks for having me. I just wanted to say that right before the holidays, I got a prescription for a face cream for an autoimmune skin condition, so not something, banal. And I went to pick it up, and they said, oh, yeah, your insurance, which, by the way, I now pay twice as much for as I did before the holidays. They're rejecting this. They're not permitting you to get it. You can just pay out of pocket, he said very calmly. And I, was disappointed, but I was like, okay, I just really need this stuff. $750. And I just left, obviously, without it and feeling really pushed around and bullied that I need this stuff and can't get it. Anyway, long story short, I went to Paris over the holidays, and I was able to walk into a pharmacy and get it for $99, just willy-nilly like that.
Well, if you can't get a good face cream in Paris, where can you get one? No, I'm kidding. But $99 compared to $750,
Right.
Chelsea, that's quite a comparison. Does that fit into a pattern that you're aware of? And I've made a joke about face cream, but it's a prescription drug. So where does this fit into the U.S. versus Europe pricing?
Yeah, exactly. And this is exactly why President Trump has pushed most favored nation, which is his policy to bring the drug prices down comparable or lower than European prices, because that is just an experience across the board that Europe is paying and other parts of the world are paying a lot less for these drugs than we are. So the deals that President Trump is striking with the pharmaceutical companies is to get them to agree to lower their prices to be comparable to those in European countries or even lower. And, of course, that remains to be seen. Some of these deals are still ongoing, and we're still waiting to hear more details. But that experience is exactly where I believe the president is coming from when he talks about most favored nations.
Here's something that we just looked up with respect to what you can use when. This is from, let's see, is this the New York State Department of Health website? Yes. So this is for people on Medicare and Medicaid in New York State. So that's a particular population. But if you're in that population, listen up. It says if enrollees do not participate in a Medicare prescription drug plan, they may lose all their Medicaid benefits. However, some people on Medicare and Medicaid may receive a letter from their employer or union stating if they enroll in Medicare Part D, they will lose the health care benefits provided by the union or employer. If an enrollee has received this letter, they may disenroll from the Medicare prescription drug program by calling 1-800-MEDICARE. So now that I've thoroughly confused you, even more than you were confused a minute ago, at least you know that there are some moving parts. And if you're in any situation that sounds like it might be that, check with your employer, check with your union, check with your doctor. All right. I want to bring up this issue for pharmacies that might potentially lead many not to participate in TrumpRx pricing. Here's a clip from a report on the Fox station in Huntsville, Alabama that I came across today, Fox 54, Huntsville, Alabama, about a disconnect that could leave pharmacists paying for the subsidy, or pharmacies, rather than the government.
While patients may pay as little as $199 for medications like Ozempic, pharmacies still have to purchase these drugs at their regular wholesale cost, which can be more than $1,000. Association representatives say pharmacies don't yet know where that difference will come from, leaving many hesitant to participate until more details emerge.
So are you familiar, Chelsea, with that issue, or if the government is resolving it in any way? Because this is supposed to be a reduction in price not being borne by pharmacies.
Mm-hmm. I can say a little bit about that. And it comes back to what I said earlier, that the government is is pushing towards consumer-driven healthcare, right? So you are purchasing a drug through a direct-to-consumer model as opposed to going to your pharmacy. So what that means is you go online and you buy the drug versus going to CVS or going wherever your local pharmacy is and working with the pharmacist to figure out how to get it. And I can say that this is certainly something that HHS Secretary Robert F. Kennedy Jr. is very interested in. I heard him speak yesterday at the Heritage Foundation, and he talked a lot about making it more possible for consumers to decide for themselves which drug they want, if they want to do this certain service. So it's really about shifting the not just the costs, but also the information, the decision making onto the consumer when it comes to their health care. When it comes to pharmacists, of course, it still remains to be seen. But again, it just shifts the focus away from them. And, certainly creates this price competition for them that they are competing with these direct to consumer avenues as opposed to before.
When we come back from a break, I want to pull back the lens and look at where TrumpRx fits into the larger picture of healthcare inflation in the United States and what each party beyond TrumpRx is proposing in this run-up to the midterm elections, since healthcare looks like it's going to be a very salient issue. And listeners, you can call in on that as well with our guest from Stat News, Chelsea Cirruzzo, 212-433 WNYC 212-433-9692. Chelsea, a Washington reporter at the health news website Stat, who previously wrote Politico's daily health policy newsletter, so she's all over this health policy beat, and we'll continue with her in a sec. Brian Lehrer on WNYC as we continue for a little bit more on TrumpRx, which was introduced last week for a better price for some people on some prescription drugs, and pulling back now to the larger question of healthcare as an issue in the midterm elections with Chelsea Cirruzzo, Washington reporter for the health news site Stat News. Chelsea, if health insurance, well, let me back up one more step. What are some of the big factors, if you can say, driving up healthcare costs overall? And how significant is pharmaceutical inflation as a factor in that?
Yeah, I can't say exactly like percentages or, what each one is contributing, but it is a lot of factors. Drug prices, of course, the ACA subsidies did end last year. And that means people's premiums went up. So people are just paying a lot more money for healthcare. On top of that, when we have more people who are uninsured, and you said this at the top of the hour, that fewer people are signing up for health insurance given higher premiums. When you have more people that are uninsured, the price, the way hospitalizations, if there's an accident that happens, uninsured costs are very high on providers, right? You have somebody who comes in and can't necessarily pay for the care that they're receiving. And of course, hospitals do have to provide that care. So it's a combination of factors of the drug prices, the premiums, and the uninsured rate.
The numbers I'm seeing for Obamacare enrollment after the extended subsidies expired are that it's down this year by 1.2 million people compared to last year. But that's actually a lot less than the 10 million or more losing insurance that many people predicted. Have you reported on those numbers and what they reflect?
Yeah, just a little bit. I mean, we have noticed that it's far less than what was expected. Of course, advocates for the subsidies say this still matters, that, people losing insurance drives up costs across the board. But again, those who, said that these concerns were overblown, certainly have pointed to those numbers to say, listen, it didn't drop as much as we were expecting.
Since TrumpRx is for the uninsured, can we say that it's aimed politically at those Americans losing Obamacare because of the Republican defeat of the extended subsidies, to mollify what might be their anger or alienation in the midterms?
I mean, certainly it's all part of a political calculus by the president. He wants to say that he is driving down healthcare costs. Of course, his opponents will say that's incongruent with efforts that he's made to end the subsidies, efforts by GOP lawmakers to disenroll people from Medicaid or to restrict the number of people that can be on federal health care programs. But for the president, saying I have TrumpRx, saying I've made these deals, again, comes back to that consumer-driven market that they're trying to promote here, that you as the consumer can find lower prices. You as the consumer will be able to pay less for your healthcare through the deals that we have made. Whereas when you look at the insurance market, people are still paying very high premiums, high cost for drugs. And again, that's not to say that being uninsured is the move here. It's hard to say, but again, if you are uninsured, that does drive up health costs if you have to go to the hospital, or you are in need of an emergency procedure.
Oh, here's one other question from a listener. Before we go to the big question, kind of big picture question of what the Democrats and Republicans are proposing, in the run up to the midterms, Karen in Manhattan has a question that probably applies to a lot of people about how she shopped for a better price for prescription drugs. Karen, you're on WNYC. Thanks for calling.
Yes,
Karen.
hi.
Hi.
Can you hear me? Hi.
Yeah, we got you.
Yeah, there are many expensive prescriptions that offer copays that aren't available to people who are on Medicare, Medicaid, or other government programs. And they are cheaper on places like GoodRx, which I guess is the same thing as TrumpRx. But I found them to be even cheaper on Canadian pharmacies online. So, for example, I have a medication that costs over $600 at retail. I'm not eligible for any copays. It's $250 approximately if I use GoodRx, but I can get it for less than $125 if I use a Canadian pharmacy that's certified. Is that legal? And what do you think about that?
Chelsea?
I can't comment necessarily on if it's legal. If you're able to get it, through legit means, I think, I'm sure that's fine. But yeah, I mean, it comes back to what I was saying earlier. Other countries are paying far less for drugs than we are. And that is something that the Trump administration has really focused on with their most favored nations policy, lowering those prices. That said, I mean, as you just demonstrated, has that panned out quite yet? No. As you were saying, that the drug was far cheaper at a Canadian pharmacy than a U.S. one. So their messaging is we're going to lower the prices down from these other countries. But in reality, it doesn't quite look like that.
So if health insurance, prescription drugs and other healthcare costs, including health insurance, are going to be an issue in the midterms, can we say that the Trump administration or the Republicans, let's say, as a party running in the midterms, or do Democrats have bigger picture plans to rein in these costs?
Mm-hmm. I think both parties would say that they have big plans to rein in the costs because, we can say the blame game here is particularly strong. Each side is saying the other side is responsible for driving up prices. And it is really an important messaging war as we approach the midterms because there is a consensus that the government needs to step in and lower healthcare prices. Where they differ is in how they want to do that. So, GOP legislation has focused a lot on market solutions targeting middlemen known as PBMs, pharmacy benefit managers, which is a whole other complicated part of the healthcare system that we don't need to get into. But they argue that they drive up drug prices. So they want to rein them in. Whereas the Democrats want to focus on strengthening Medicare price negotiation, basically strengthening the government's power in driving down these prices versus, putting controls on the market. If that makes any sense? I'm sure we've confused everybody here, but, just know that it is a pretty huge war between both sides.
Here's a big picture question from a listener, and several are writing in with versions of this. Very simple. This is just another smokescreen, writing about TrumpRx, designed to pull the wool over Americans' eyes and avoid the real issue. We should have free, universal health care. But even the Democrats are not running on that, right?
That's true, and not at this time. I mean, that was certainly true for some people years ago when I first started covering healthcare, but not so much. And one thing I will say based on our analysis yeah, we found that the TrumpRx does not lower prices as much as the president says it does. I mean, we found that half of them are actually available as generics for far less. So knowing that, going into that with that knowledge, I think is really crucial.
Here's a physician calling in, Jane in Brooklyn. You're on WNYC. Hi, Jane.
Hi, can you hear me?
Yep, we hear you.
Yeah, hi. I'm calling because, I work in a major academic medical center. I'm a physician. And my son was recently diagnosed with a chronic medical condition that requires a specialty medication. We started on it in December. And then our insurance changed the pharmacy benefits from Express Scripts to Carelon. And Carelon refused to pay for the medications. So, we've been dealing with fighting, and appealing. But in the meantime, in order to avoid, abrupt discontinuation of the medication, I've been looking into what the out-of-pocket costs would be for this medication. And even with the manufacturer, patient assistance program, it would be about $22,000 a year cash. The one that the pharmacy, paid for before they switched over, it was $13,000 that the pharmacy paid, and with the patient assistance, it would be about $2,000 cash for me. And I looked at GoodRx and all these other places to figure out what else I could do to get this medication for my child, and it's thousands of dollars. It got to the point where I was able to get an emergency authorization to continue the medicine. The copay for the 1 month that I've so far filled was $3,817, just the copay. So it's actually cheaper to buy it cash with the patient assistance than to use the pharmacy copay benefit. And I was actually, seeing a patient when I got one of the many denials from Carelon, and my patient actually is a retired, police officer who cannot afford his specialty medication that I see him for his condition for, buys from India. So I literally got this phone call, and I turned to him and said, I may need your source, to get my son's medication.
And you're a doctor, and you're having this kind of complicated problem getting coverage for your son's medication. So, Jane, let me ask you, as a physician, and having gone through this, still going through it, I guess, do you have a structural solution to solve this? Jane, I'm asking you.
Oh, yeah. Well, yeah. Honestly, the answer is a single-payer system, right? Because at the end of the day, I can't even tell you how many hours, literally almost every day on the phone for hours with various, insurance people. And it's a very obscure process. And I'm a physician, I have health literacy. I do this for my patients, right? And I still am struggling, and I haven't been able to resolve this problem on my own. And I feel really bad about, I've been reaching out to the physician who's prescribing this, and it's very frustrating for them too. We spend our time on the phone with all of these pharmacy people, all these insurance people. We don't get paid 1 red cent for it, and we still can't get the medications for our patients. So, honestly, what really needs to happen is to have a closed system where the cost of my time, fighting with insurance is not borne by me as a physician. The patient isn't the one, having to negotiate cost for medication directly. And, the government, as the buyer of all the medications, has the ability to negotiate the cost on large scale. This is what other countries do.
Right. Jane, I'm going to...
many Latin American countries band together and negotiate for essential medications like PAHO, to come up with a cost for multiple countries that are buying in bulk.
Dr. Jane, thank you very much for calling in and sharing your story and your views. And that doctor is going to get almost the last word. Chelsea, I want to throw in one other thing off topic, because I know you cover vaccines a lot. Here is Dr. Oz from the Trump administration on CNN just the other day, surprising some people by saying everyone should be vaccinated against the measles.
Take the vaccine, please. We have a solution for a problem. Not all illnesses are equally dangerous, and not all people are equally susceptible to those illnesses. But measles is one you should get your vaccine.
So, Chelsea, is this a change in position from what his boss RFK Jr. has been saying? The setup to that, Dana Bash from CNN, was talking about big outbreaks of measles in the country. I don't even think these are getting reported on so much. Maybe, the media has become complacent about this. But because we heard about that outbreak in Texas a little while ago, she was citing an outbreak of more than 600 cases in South Carolina. I think hardly anybody knows. But that was Dr. Oz's response to that. Is that a change in tune?
I would say HHS probably would say no, but it does sound a lot different from what we've been hearing. And let me back up for a second. You alluded to it just now. Yes, the measles cases across the U.S. have grown to alarming numbers. And in fact, the U.S. is in danger of losing its measles elimination status. A couple weeks ago, my colleague Helen asked CDC, if they were concerned about losing that status. And the response was that is just the cost of doing business and that they are not necessarily so concerned about it. But it is true. Measles is on the rise in the U.S. I live in Washington, D.C. There was just an alert that people in D.C. could have been exposed to measles because somebody who had it had recently traveled to the city, which is not something you expect to hear every day. Now, Dr. Oz's comments, you should take the vaccine, it comes after Secretary Kennedy has been wishy-washy on whether or not you should take the vaccine. He has said explicitly earlier this last year that, yes, take the vaccine. It is the best way to protect against measles. At the same time, he has cast doubt on the vaccine itself. He has referred to it as a leaky vaccine. He has caveated his statements by saying it's your choice. And the reality is vaccination, as Dr. Oz was saying, there is the best tool to prevent measles. And Kennedy has sort of instead talked about unproven treatments like vitamin A to treat measles at the same time as discussing the vaccine.
All right. Our next debate show, we'll have Dr. Oz on one side, his boss RFK Jr. on the other. No, I don't think they'll come on for that. But with that, we leave it with Chelsea Cirruzzo, Washington reporter at the health news website STAT. Thank you so much for all the information.
Thank you so much.
Brian Lehrer on WNYC. I know you want to talk to our next guest, New York City Sanitation Commissioner, on the cleanup and sometimes lack of garbage pickup since the snow. Stay with us.